I want to introduce Kathleen Sebelius. She, of course, is the former governor of the great state of Kansas. Any Kansans in the room? Yes, a couple. Good, give it up for Kansas. There we go, thank you. She is, of course, the 21st secretary to lead the department that is charged with maintaining and perpetuating the health of all Americans. There are a remarkable 80,000 employees in the Department of Health and Human Services. It is one of the largest agencies in our federal government, and she has been hard at work promoting the priorities of the administration, the Affordable Care Act, and of course the initiative that brings us all here today, the Health Data Initiative. So please join me in welcoming Secretary Sebelius.
Well, good morning, everybody. I am really delighted to be here at Datapalooza 3, the Todd Park Roadshow, and thrilled that all of you are joining this effort. I think that it's only fitting that in addition to our in-house rock star, Todd Park, we had a real rock star yesterday, and Bon Jovi here. It's really gathering momentum, and you heard from Thomas how many stars were involved yesterday and coming today. I think, you know, to have Bill Frist here, who really has been a leader in this area for a long time, a great insurance colleague, and Mart Bertolini, Atul Gawande, who has participated in this in the past and will continue, and great government partners at EPA and USDA and the Veterans Administration. This is really an exciting opportunity, as was just said by Thomas, to take lazy data and get it into the mainstream. And I want to thank Harvey Feinberg and Judy Salerno from the Institute of Medicine for being such gracious sponsors of this initiative. We really have been working for a while to make this day possible, and I want to thank all of the innovators who are here today, because it's really at the point where the data is unlocked that you come into play. The fact that you're here is a real tribute to your imagination, talent, and persistence. Now, 2 years ago, the Health Data Initiative began with 45 people in a conference room, brainstorming for a vision about how data could be used to improve care and improve the health of Americans. And it was our department that brought that group together, Todd Park, and we knew we had a limited role to play in making the vision a reality. We could be a convener, we could be a catalyst, but there was only one force powerful enough to drive the kind of transformation we're talking about, and that's American entrepreneurs. Less than 2.5 years later, the results speak for themselves. We've gone from those 45 people brainstorming in a room to an overflow crowd of more than 1,600. We've gone from 21 applications submitted at the first Health Data Initiative to nearly 250 submitted leading up to today. And most importantly, we've begun to see some of those innovations make a real difference in the lives of millions of Americans across the country. So we made a bet 2.5 years ago that if we broke down the barriers to innovation and unleashed American ingenuity, we could begin to transform healthcare forever. And I think we were right. But as exciting as the last few years have been, we're just getting started. Now, when I compare the health system today to the health system that I grew up with, there have been some amazing changes. Remarkable new medicines and vaccines, incredible technologies like MRIs and CT scans, miraculous new procedures like heart transplants. But other parts of the health system that decades later look frozen in time. Let's take just one example, a mom who's been referred to a cardiologist for an irregular heartbeat. 40 years ago, she didn't have an easy way to find a specialist except asking her doctor or her friends. When she got to an appointment, she had to fill out her health information from scratch as if she fell off the moon. hoping she didn't miss some crucial detail. Her doctor would make a diagnosis despite having little access to past test results or notes from other doctors involved in her care. And she'd be sent home with a treatment plan, but no easy ability to check on her progress or ask questions until the next time she physically went to her appointment. Now today, that exact scene from 40 years ago plays itself out thousands of times every day. The only difference is that Wired magazine may now be in the waiting room instead of the magazines you would have found 40 years ago. What we have is a huge innovation gap in healthcare. And while we've made great progress over the years in developing more advanced medicines and treatments, we've made little progress in other areas, from how patients track and manage their own health, to how they choose a doctor, to how doctors work together to develop a treatment plan. And where there's no innovation, there's no improvement. So the result is we have massive inefficiencies in our healthcare system that harm our health, waste doctors' time, drive up costs for families, businesses, and governments. So the innovation gap is the underlying problem that contributes to all our other healthcare challenges. And that's why this administration has made closing the gap one of the top priorities. Now, as I said earlier, we knew government couldn't do it alone, but we also knew we have a key role to play in removing the obstacles holding innovation back. And that's exactly what we've tried to do, starting with changing financial incentives in our healthcare system. So for way too long, for all those 40 years, we paid for healthcare in a way that not only failed to reward innovation, but could even punish innovators. For example, if a hospital system improved follow-up care so they had fewer readmissions, they often made less money than if they filled those beds. And that meant there was little incentive for innovation, since if your idea for improving care was too good, it put your own system out of business. So one of the things we needed to do is change the way we paid for care to begin rewarding improvement. And because Medicare and Medicaid together cover about 100 million Americans, 1 in 3, we had to start with those systems. And that's exactly what we've done through the Affordable Care Act. And we're already seeing some very exciting results in the last 2 years. Later today, some of you will attend the panel on accountable care organizations, or ACOs. Even a year ago, this was a hypothetical conversation. But today we have 60 major health organizations around the country who have signed up to be ACOs, with another 150 applications for a July start date. And this is just one of the dozen new opportunities in the law. And what this means is we're developing a sustainable business case for healthcare innovation. If you have an idea, and you're a healthcare provider or a health system, on how to keep people healthier, cut waste, and improve care, there is now a demand for that idea. And the demand is only going to grow. The second step we took to support innovation was to set in motion a national transition to electronic health records. Now, we knew that electronic health records were a key platform for health innovation. They put up-to-date information in the hands of doctors and patients with potentially huge health benefits. For example, a recent study of more than 27,000 adults with diabetes found that those with electronic health records were 600% more likely to get the right care. 600% improvement. But because electronic health records also come with significant challenges like high upfront costs and comparability issues, just 20% of primary care doctors and 1/6 of the hospitals across the country were using electronic health records when this president came into office in 2009. We were stuck in an era of the past. But over the last 3 years, using funds from the Recovery Act to start removing those obstacles, we're helping to establish common standards for sharing information, giving hospitals and doctors incentive payments to help offset the startup expenses, And the result is that today, just 3 years later, twice as many hospitals and primary care doctors are currently using electronic health records, and that trajectory is just going to grow. And when you add the fact that smartphones now account for more than half of all phone sales in the US, we're seeing an unprecedented expansion of all platforms that can support new health innovations. So if new incentives are part of the engine for innovation and new technologies like electronic health records are the vehicle, then data is the fuel. That was the bet we made 2 years ago when we launched the Health Data Initiative. Our theory was, if we took the vast stores of data that our department already had, stripped all the personal information, and made it available to developers, you would use it to create incredible tools. And that's exactly what you've done. The dozens of new applications being presented this week include tools for helping policymakers strengthen public health programs, helping healthcare providers, doctors, and nurses deliver better care, helping consumers better manage their own health, and bringing more transparency to healthcare to foster competition and to drive improvement. Part of what makes this year's event so exciting is that many of these tools were created by companies that only formed in the last year or two. But it's also exciting to see innovations that were presented in the last years continue to grow. Now, iTriage is a perfect example. This platform was created by an ER doctor from Colorado, and it's a one-stop app that helps people figure out what's wrong, what they need to get better, and where to get it. Since being introduced 2 years ago, it's added new features, grown into a company of 65 employees, and has been acquired by Aetna, where it's now a key part of how that insurance company gets consumers involved in their own care. And that's just one of the many success stories that have already been written over the last couple of years. As you heard yesterday, we're committed to giving entrepreneurs even more fuel by making more data available while maintaining absolute protections on patient privacy. Now, simply put, the conditions for healthcare innovation have never been better than they are today. We have a growing demand for new tools that can improve care and reduce costs. We have a growing number of platforms that can support those tools, and we have a growing amount of data, lazy data, that can power those tools. We have the engine, we have the vehicle, we have the fuel, and now we need the drivers, and that's you. Now, I know I don't have to convince you the size of the opportunity in front of us. When you take the biggest technology breakthrough of our time and apply it to one of the most persistent social problems of our time, it's not hard to see the potential for growth, not only here, but around the globe. There's a reason the venture capital investment in health IT is up 60% since 2009, even in these challenging times. And while I do believe you're helping to create a high-tech sector that will be a powerful source of jobs in the future, the biggest beneficiaries of your work won't show up in analyst reports or in earnings statements. There'll be retirees who will live to see their grandkids graduate from college because they can better manage their chronic condition. There'll be the healthcare providers who get to spend more time with their patients and less time with their paperwork. And it will be the woman with the irregular heartbeat who hopefully 10 years from now has a very different experience than she would have had today. Instead of searching blindly for a specialist, she'll be able to use her phone to easily compare local doctors and schedule an appointment. When she shows up, the office will already have her complete medical information, so she won't have to worry about some key detail falling through the cracks. She'll leave with better tools for monitoring her own progress and getting answers in between appointments. And her doctors will be able to easily communicate with one another to coordinate her care. It's a healthcare future with better care, less waste, stronger connections with your doctors, and more personal control. And the only way we can get there is closing the health innovation gap. And I believe I'm with the group of people in the world who can do just that. Fortunately, you're here in this room. So I want to thank you for everything that you've done so far over the last couple of years, but I can't wait to see the results of this year and what you come up with in 2013. Thanks very much.